newborn care is probably the thing that I am most passionate about. Like I, again, could talk forever about why newborns to get adjusted. People often ask me, when's the best time to get adjusted? And I always say A, at birth, or B, right now. Like, let's get started today. And the reason why at birth is so important is because we often think of the labor process as very traumatic for the mother, which it is. Like, we've both been there, right? I'm a mom myself. I've been through the labor process. I know how that goes. And I know it's very uncomfortable for the mom. So there's no denying that. But with that being said, it is also very traumatic for the baby. Without getting too graphic, the baby has to fit through a really small space and come out into the world, right? Have you ever thought about how a baby has to come into the world? And it can be very traumatic for not only their skull and their head, but also their neck. So the first thing that I check whenever I check a baby is their cervical spine. Because oftentimes when babies are born, they get pulled out by their head, right? Even with C-sections, it's still important to get babies checked as well. We look for things, we check their reflexes. They have what we call primitive reflexes. We check those in the office and make sure that those are all present and functioning well. We also go over with the mom, breastfeeding. How's breastfeeding going if that's something that you're interested in doing? How's the baby going to the bathroom? How's the baby eating, gaining weight? We go through all those different things in the child and make sure that the child is growing and developing well. Also, we see a lot of conditions in the office, and like I said, chiropractic isn't necessarily a condition based. We treat the nervous system and allow the body to heal itself, which is really cool and something that no other branch of medicine or healthcare does. But we do see a lot of conditions in our office, and that's what brings the children in, usually like toricolis, constipation, problems latching, any kind of stomach discomfort, anything like that are different conditions that we see in babies. Acid reflux, that's the other one. That one's huge. I get a ton of babies with acid reflux in here. So those are some of the things that chiropractic care can help with. But like I said, we treat the nervous system. And what that looks like is whenever you get adjusted, we're able to affect the nervous system, which is your brain, your spinal cord, and all of the nerves that innervate or control your body. So being able to affect the nervous system at the very root of the cause is a really powerful thing and powerful tool that chiropractic care can offer.
You're coming to our expo. You're actually one of our platinum sponsors, so you're going to be speaking at the expo. Can you talk a little bit about that?
Yes, so I am super excited to be at the expo in April. It is going to be a blast. I've done a couple before, but this is the first one that I get to be one of the main sponsors and a speaker. So I really am excited about that. I plan on kind of talking a little bit about what we talked about today. I'm going to go into what some pregnancy care looks like, a little bit of postnatal care, which we haven't got to talk to or hit on about today as much on our conversation. But then I also want to kind of talk about newborn care and pediatric care and just some of the conditions that we see most commonly and how chiropractic care can help. But also hitting home the point that chiropractic care isn't always about conditions. We treat healthy people and help them live a more beneficial life just through being healthy and being able to have their body and those systems function well. So just touching base on that too.